What's up? Welcome back to my channel. The most common skin conditions and their cures. It is nothing to be ashamed of to have a skin condition. The overwhelming majority of people will experience one at some point in their life. The key to treating skin conditions is to inspect your body regularly in order to document any abnormalities. If there are sudden changes, then the best thing to do is to go to a dermatologist or your family doctor. If you're interested in the most contracted skin conditions and how to take care of them, stick around this video. Number 1. Cold sores. Cold sores are caused by the virus herpes simplex, which is very contagious. They are fluid-filled blisters that occur around the mouth. They can go away on their own, yet are a little painful. There is no cure for the virus, but drugstores do sell antiviral creams to ease the pain. Number 2. Blisters. Blisters are an extremely common skin condition. They are the result of pressure on the skin, burning, or sometimes more serious conditions. They will usually go away on their own. The key is to keep it clean with disinfectant. Putting hydrocolloid dressing on the area will also reduce pain and speed up healing. Number 3. Hives. Hives can take a few forms, including blotching on the skin and raised red spots. Hives appear when your body is producing high levels of histamine, usually in response to an allergy. Taking antihistamine medication will usually reduce the itchiness. If the hives stay for a prolonged period of time, then you should go see a doctor. Number 4. Actinic keratosis. Actinic keratosis is when some patches of your skin turn dry and scaly due to overexposure to the sun. They are not dangerous in themselves, but can turn cancerous down the line, and so are important to keep an eye on. You can remove them using creams, cryogenic freezing, surgery, and photodynamic therapy. Number 5. Rosacea. Rosacea is when you get red patches on your skin, usually on your cheeks. You can also get raised bumps and broken blood vessels with this condition. The condition is long-term and is rarely cured. However, there are some treatments you can try, such as prescription creams, antibiotics, and intense pulsed light therapy. Number 6. Boils and carbuncles. A carbuncle is when a bunch of boils cluster together to form a large, raised lump on your skin. They are usually painful and secrete pus. You should not try to squeeze them, they will go away by themselves. It is better to soak it with a warm towel 4 times a day, and keep the area clean. Number 7. Latex allergy. A latex allergy ranges from just getting a rash to having severe throat swelling when latex particles are in the air. Many people are allergic to latex and there is no cure. If you have a major allergy, you should carry an EpiPen on you at all times. Number 8. Atopic eczema. Eczema is certainly one of the most common skin conditions among humans. It causes the skin to become dry and itchy. It is a long-term disorder. However, there are things you can do to reduce the pain. Moisturizing every day and using topical corticosteroids can help. Number 9. Psoriasis. Psoriasis leaves silvery scaly patches on your skin. It usually happens on the scalp, elbows, knees, and lower back. It is caused by a buildup of skin cells. Treatments include topical corticosteroids or oral medication for more severe cases. Number 10. Measles. Although many people are vaccinated against measles, it is still possible to contract. The illness causes a red-brown blotchy rash on the skin, as well as other cold-like symptoms. There is no immediate cure, but you can fight against it by taking regular anti-pain medication, drinking lots of water, and staying home to prevent further infections. Number 11. Basal cell carcinoma. Basal cell carcinomas are little raised spots on your body. They are often red and swollen with a sunken center. It is a type of skin cancer. It is important to have your skin checked out regularly, and if there is a basal cell carcinoma discovered, the dermatologist should get rid of it through surgery. Number 12. Squamous cell carcinoma. A squamous cell carcinoma is another kind of non-melanoma skin cancer. It looks like a firm, pink lump with a crusted surface, and will be tender to touch. The area should be removed surgically by a doctor to prevent the spread of skin cancer throughout your body. Number 13. Melanoma. Melanoma is another type of skin cancer that usually arises from a mole. If you have a new mole or one of your moles has changed, then you should go see a dermatologist. If it is cancerous, then the doctor will simply remove it if it's in its early stages. More developed cases require serious treatments. Number 14. Lupus. Lupus is a condition where skin rashes are one of the symptoms. The disease also causes extreme tiredness and joint and muscle pain. It cannot be cured, however. Treatments include anti-inflammatory medicines, hydroxychloroquine, and steroid tablets. Number 15. Contact dermatitis. Contact dermatitis is eczema when it is caused by a specific substance. The key to curing it is to identify which substance you are allergic to. The rash itself can be calmed using emollients and topical corticosteroids. Number 16. Vitiligo. Vitiligo is a common skin condition where white patches develop on your skin because of a lack of melanin. There is no cure, but the effect can be reduced by suitably protecting your skin from the sun. Number 17. Warts and verrucas. Warts and verrucas are hard bumps on your skin that usually go away by themselves. You can also freeze them off, or have them surgically removed. Number 18. Acne. Acne is the appearance of blackheads and pimples on the skin, usually on the face, neck, chest, and back. Minor cases can be treated with antibacterial face wash, but more severe cases require stronger medicine, such as retinol and adapalene. Number 19. Chickenpox. Chickenpox usually takes place in children. However, if you do not get it when you're young, you are at risk of getting it in adulthood in the form of shingles. The sickness causes itchy spots, high temperatures, and fatigue. Luckily, it should only last around 2 weeks, and once you build up immunity, it is unlikely that you'll get it again. Number 20. Seborrheic eczema. Seborrheic eczema is when oily areas on your body become rough, dry, and produce dandruff. It is quite common with newborn babies. It usually goes away by itself, however, you can use prescription shampoos and ointments to tackle the itchiness. Number 21. Keratosis pilaris. This condition usually happens on the back of the arms. It is not harmful and just causes the skin to look more bumpy and red. It can be managed by moisturizing regularly, using unperfumed products, and by exfoliating your skin. Number 22. Ringworm. Contrary to the name, ringworm is not a worm, but actually a fungal rash. You can catch it from cats and dogs, but it can be cured by antifungal cream. Number 23. Cysts. Cysts are large lumps of fluid that form underneath the skin. They often go away by themselves, but can be uncomfortable. Do not try and pop it. Instead, go to the doctor. The best thing to do is to keep it clean and free of infection. Number 24. Cellulitis. Cellulitis is a skin infection that causes part of your body to become hot, swollen, and painful. If you suspect you have it, it should be treated quickly with antibiotics prescribed by the doctor. Number 25. Hair loss. All humans experience a bit of hair loss in their life, especially men. While there is no cure for hair loss, there are some innovative treatments to prevent it. These include minoxidil for women and finasteride for men. Thanks for tuning in. Have a joyful time. Feel free to give it a thumbs up, subscribe, and share if you find the content valuable. Welcome to Heartbeat Station.